Here at Surrey and Sussex Healthcare NHS Trust, we decided to use World TB Day to raise the profile of our TB nursing service. Our TB nursing team consists of 2 TB specialist nurses and 1 team administrator. The team covers both Crawley Hospital in West Sussex and East Surrey Hospital in Redhill. We have our nurse-led clinics and consultant-led clinics at Crawley Hospital, with ad hoc nurse-led clinics at East Surrey Hospital. East Surrey Hospital provides all of the acute inpatient care. So the following 3 slides outline the work we did in 2016 to raise our profile. We held information stands at both Crawley and East Surrey Hospital. This gave members of the public and staff the opportunity to come and talk to us, ask us any questions, share any concerns. We also got to listen to many of their experiences of TB. We did find that there are an awful lot of comments similar to, "Oh, I thought TB was a thing of the past." This obviously gave us a really great opportunity to educate some of our local population. We designed a quiz sheet and people filled them out while they were visiting our stand. They could either take an answer sheet home with them or they could check the answers with us on the day. This was really well received and was quite a bit of fun. We even managed to get some of our consultants to fill them out. During the day at East Surrey Hospital, the 2 TB nurses visited specific wards. We chose to go to emergency department, acute medical unit, the respiratory wards and intensive care unit, and we gave out our ward packs that we'd put together. The packs included TB symptom poster, which is from TB Alert, the TB nursing service leaflet, which included our telephone number and team email, a BCG baby leaflet from Public Health for England, and a TB leaflet from Public Health for England. We also included some of the A5 sized symptom cards from TB Alert and the smaller credit card sized symptom card from TB Alert. And the aim of these packs was for them to be put in the staff rooms essentially, and just really encourage healthcare professionals to be thinking a lot more about TB when they're assessing patients. We also sent out packs to all the GP surgeries in our area, which included all of the same materials as the ward packs, and we also wrote a covering letter introducing the members of the team. We designed some World TB Day posters, which I'll show you within the next few slides. These were also included in the ward and the GP packs, and we put them up on notice boards throughout the 2 hospitals. Our communications team was crucial in helping us to advertise the TB information stands. They added our details to the weekly e-bulletin, which is emailed out to the whole of the trust. They put information on the home intranet page. They did a Twitter feed throughout the day on the 24th of March, and they even popped down to see us at one of the hospitals to take a team photo. We also used the World TB Day as an opportunity to add a TB nursing page to our trust intranet site, introducing the team and putting some general information on there about TB, signs and symptoms, and how you would diagnose TB. At the bottom of our emails, we updated our signatures, basically saying 24th of March is World TB Day. So this slide is just showing you some examples of the Twitter feed, which was put up actually on World TB Day. This slide shows the World TB Day poster that we designed, which was included in the ward packs, the GP packs, and put up on notice boards. And this slide is showing you the example of the quiz that we've put together. This is our new TB team poster. So looking back on the work we've done in 2016, we've come up with a few ideas for our next World TB Day. We'd like to start planning earlier next year, revisit the packs that we sent out, and ensure that we have included clear and concise information. We've discussed getting in touch with the hospital radio station to see if they can help us to raise awareness of TB and advertise World TB Day. Next year we're definitely going to include the immigration removal centres, local places of worship and Crawley Open House in the packs that we send out. Crawley Open House is a local support service for those suffering the effects of homelessness, unemployment, loneliness, discrimination or any other forms of social exclusion. Our information stand at Crawley Hospital wasn't as well received as the stand at East Surrey Hospital, so we'll look at the positioning of the stand within the hospital, the timing of the stand, and work on better advertising for 2017. We've also decided that raising awareness of our profile doesn't just need to be on World TB Day, but that we can do this all year round. Therefore, we've booked a stand in July for a TB awareness stand, which will be at East Surrey Hospital for a few hours. We'll also consider doing a GP mail out of slightly smaller packs in the autumn-winter season of 2016. We're currently working on updating our Team TB page on the intranet site to include the TB Nice guidelines and some referral guidance. We'll also add the TB quiz on there. We've designed a new TB nursing poster which will replace the World TB posters, and you'll see this on the next slide. Since this year's World TB Day, 3 different practices in our areas have contacted us after reading the packs that we sent to the GPs. Out of these 3, one of them has already completed her online training. We were also invited to Acute Medical Unit to give a teaching session. I would like to thank the whole of the TB nursing team for all of their efforts in making our awareness raising so successful, to thank our consultant for his support and teaching, to thank Lara Child and our communications team for helping us put the presentation onto YouTube, and for all of their work around advertising World TB Day. And this is our photo of the team